But today's section is purely to look at, as you all know, as a qualified social worker registered with the Social Work England, you need to have your annual registration renewed. As part of the renewal process, you have to have certain conditions met. So today, Victoria is going to talk about those, look at the registration process, look at the standards that are occurred by social workers in England, and also, what is the renewal process that's going to be happening, and any update from Social Work England. So as you all know, we are also looking at a kind of wider national conference on BME social work issues, challenges, and opportunities. So with Victoria's help, I managed to speak to Ahmina, who is the head of equality in Social Work England, who is, agreed to join us. So I'll update you with the date and times later on. So as I want to say that Victoria is not a new face to us, but a familiar face, a helpful face, a friend and companion of our forum. So I'm pleased and very much pleased to welcome Victoria to this evening. So and hand over the mic back to, because as soon as I get a mic, I never leave that. But for today, Victoria, is for you. Yeah.
Thank you so much. I mean, and thank you just for that very generous introduction. And I'm hoping you can see. Can you see the slides? Can I just check that you can see my first slide?
Yes, yes, we can.
Yeah.
So just to say, it's a real pleasure to be here, and I really, really appreciate it. So to say, my name is Victoria Hart, Vicky Hart. Don't really mind either. I'm regional engagement lead for London. I know you're based all over the country, so don't worry too much about that. I have put my email address on the slides, and I'm really happy to answer any queries individually as well. So I think you'll get copies of the slides. So I've sent them on. So and just I forgot the slides do the little jazzy little intros. So basically what I'm going to cover this evening is I'm just going to just briefly a few updates about Social Work England, bit of information, background that might be new from last year, bit of updates. I'm going to go through the renewal process just really quickly as a reminder, just because we're in this 1st of September to 30th of November period, and then going to talk about CPD. And again, it's just a reminder about what the requirements are for Social Work England in terms of CPD. Opportunity to ask questions as well, and yeah, that's it really. I'll try and get through fairly speedily so we can have time for questions. I'm happy to, I think I've gone in the wrong direction there, haven't I? Happy to answer questions as I go, but I don't think I can see the chat. So, just to be aware that I might not be able to see the chat until I've stopped sharing. So just a little bit of background about social working, and I've put some of the figures up on the screen, and this is just some data that was published in January this year, actually, and it's data from the register that was collected as of the 1st of December 2022. So around 100,000, that's actually moved up. I think it's definitely over 101,000. We might be on 102,000 now, and that's since the 1st of December 2022. So the numbers of social workers are actually rising across England. 83% female, 17% male. Male may not be a surprise to you. And highest numbers of social workers, and we've had a massive increase in numbers of applications from overseas. I think it was over 180% increase over the last year, and those highest numbers, I've put the highest numbers coming from Zimbabwe, Ireland, and India, and that's in order. So the highest number has been from Zimbabwe, followed by Ireland, followed by India.
80% increase in applications to UK.
Yeah, applications to join the new applications to join the register, and that was between the 1st of December 2021 and the 30th of November 2022. So it's the previous year. I think it will be different for this coming year because the numbers have gone down from Zimbabwe, because Zimbabwe has been placed on a list from the government where there are fewer visas issued from Zimbabwe because the Zimbabwean government have stated that there are too many social workers leaving. So I think we will see different numbers for the next coming year, but we do collect that data and publish it. Average age of a social worker in England is 46. So those of you with your cameras, thank you for bringing the average age down. We also, as well as regulating social work, we also regulate social work training courses. So we've got the 83 providers of social work training courses, and we inspect those services as well. And this is numbers of social workers around England. You can see I've put the little circle around London because that's where I'm based, and there are more social workers in London than anywhere else. But I would say I don't have any favourites, but but I think it's quite an interesting slide because it just gives a bit of a sense of where there are more social workers, as I say, in London than any other place, and the proportion of the population in terms of the ratio of population to social workers. You can see it's the lowest in London, and just kind of quite some interesting regional variations there, I think. So what do we do at Social Work England? I'm just going to zip through these animations and talk about them all together. So we maintain the social work register. Obviously, you need to be registered with Social Work England to be able to practice as a social worker in England and set the professional standards. And I'll briefly come back to the standards when we're talking about CPD. We're also responsible for handling any concerns that come up around social workers' practice. And as I said, we set the education and training standards for the universities that offer entry into the profession. We also approve some post-qualifying courses. At the moment for AMPs, we don't actually approve the BIA courses yet, but that is a function that we're going to be taking on. And if you are, so best interest assessor, mostly working in adult social work, if that is an area that interests you or that you're working in, just to be aware that we are currently carrying out a consultation about education and training standards for best interest assessors. I've got some links in the slide. So that's currently the only consultation that we've got open at the moment. If that's an area of practice that interests you, do have a look at that consultation. It closes at the end of October, so there's still a few more weeks to run. And we've got the professional standards here, the 6 standards. Is there a Thomas? Yes. Put your hand up.
Yeah, I just wanted to ask you, what about the practice educators? Are you looking into that as well?
We are looking into that. So that's kind of almost like the next stage down the line. We are really we're doing work with about practice education because it's about, I mean, we don't have any concerns about the training of practice educators at the moment. We think, generally there's not been any concerns around the quality of training of practice educators. Unlike, to be blunt, some of the BIA courses, but we want to raise the status of practice education. There is an issue with practice educators not continuing to take students, maybe after they've trained. So does there need to be more structure in place to recognise the value? And yes, that probably means money as well. Recognise the value of practice education, and kind of, yeah, and so that is some work that we will be doing. And when we do have there will be consultations around that, and I will make sure that I send you information about that. But that is absolutely on the agenda because it's such an important area, isn't it? I mean, none of us would be social workers without practice educators, and the quality of practice education is really important. So got the standards up. I'm not going to go into the standards in too much detail here, but just to kind of highlight, as I say, we develop the standards in consultation with people who use social work services and social workers. And there are the 6. Each of those 6 have a number of subsections. I'm going to focus really on standard 4 through this, which is around CPD and what that means to maintain CPD, but just kind of like to put it in the context of the 6 standards. So I'm just going to run through the renewal process. So for the renewal, so every year, if you're on the register, every year you need to renew your registration. And there are 3 things you need to do to renew your registration. One of which is record the CPD, 2 pieces of CPD. That's the same as last year. 1 piece needs to have a peer reflection, and I'm going to come back and talk to that. Now, in terms of recording your CPD, you can do that at any point in the year, but the deadline is the 30th of November. So you can do that in January, you can do that in March, May, whenever you want to, you can record and submit your CPD. Then you need to apply to renew your registration. Now, this is the part that has to be done between the 1st of September and the 30th of November. That's the point we're in at the moment. So you have to do your renewal. And then you need to pay the fee. So the fee is £90, same as last year, same as the year before. No plans to change the fee. You can pay your fee either by direct debit or in one lump sum when you do your renewal. When you go through your renewal form, it will tell you if you've got a direct debit that's active, or if you want to cancel your direct debit, change it. But yeah, I mean, so that personally, I've got direct debit, so it goes out automatically, but you don't have to do that. The other thing just to mention, I'm obviously going to come back to CPD, but I said you can submit your CPD at any point during the year, which you can. When you submit your CPD, you can continue to edit it. So even after you've submitted your CPD, you can go in and edit it up until the 30th of November. Nobody at Social Work England sees it. It's absolutely fine to do that. So for example, this year I went to a conference in June and I wrote that up as a piece of CPD. And then literally about 6 weeks later, when I'd done the peer reflection, I added that to it. So you can keep adding, taking away, tinkering around with your CPD right up until the 30th of November. So you don't need to worry about submitting it and then never seeing it again. So those are the 3 steps. I've got some screenshots. This is what your account will look like when you start the renewal process. This is the renewal form. And it tells you about your CPD. So you can do the CPD before you've done your renewal form, or you can do your CPD after you've done your renewal form, as long as you've done both by the 30th of November. So we did get some situations last year where people had done the CPD in draft, they hadn't pressed submit, they'd done the renewal form, they had pressed submit, and they thought they'd done everything. They made a mistake and didn't go back and submit their CPD. So we just want to be really clear this year that, and we also saw people that completed their renewal form but didn't press submit. So just really, really careful to press submit on the forms, on the CPD and on the renewal form to make sure it goes. We're sending reminders out. If you haven't had, the reminders, check it's not going into your spam. We are now only sending reminders if there are parts of the process that you haven't done. So if you've completed the form, you won't get the reminders. If you haven't completed the form or the CPD, you will get reminders. So don't ignore the reminders is the message, because we know a lot of people got the reminders and then thought, oh, well, everybody's getting these emails. It's just spam. But actually the reminders will be telling you if you haven't done a particular aspect. And as I say, we've had a little issues with people thinking they've done the form and just not pressing submit, and it's clearly an error, but it does end up with a great deal of distress. So on your renewal form, these are the questions that you need to answer or confirm. So areas like personal details often will not change year to year. Your name, your address, your email address. Of course, that might change. You might get married and change your name for any other reason. You might obviously move house, but generally personal details don't change much year on year. And employment details, I think, self-explanatory. Again, for most people, those don't change, but we can all get new jobs. Other regulators means if you're regulated by another professional regulator. So examples are usually nurses that are dual registered as social workers. I met last year an occupational therapist who was dual registered, or if you're registered in Wales, Scotland or Northern Ireland. So you just put the details there. Professional standards is kind of acknowledging that you've read and understand the professional standards. CPD, do you undertake to complete your CPD by the 30th of November? So it's not saying, have you done your CPD? It's saying you will do your CPD by the 30th of November, which is why you can do this form before you do your CPD. Oh, I moved back by mistake. Safe and effective practice is a few questions just about anything that might have changed over the last year, any new criminal convictions, offences, fitness to practice issues from other regulators. Vulnerable groups is about if you're barred from working with vulnerable adults or children, you'll know if you are, and it's through the DBS system. And then particular health conditions. There are very few health conditions you need to declare to Social Work England. They are only if they affect your ability to perform your role as a social worker safely and effectively, and you don't have arrangements in place to manage them. There are examples on the website, but there are very few situations. Often it might be an issue like an unmanaged addiction to illicit substances are often the ones that come out. So, and then pay the registration fee, review the information you've given, and make your declarations that it's true. So that is the renewal form. So I'm going to pause there. Any questions about the renewal form before I move on? This is a screenshot of my account, and you'll see this will be like what your account looks like now. This I took a couple of weeks ago when my direct debit hadn't gone through yet, which is why the payment is pending. But you'll get these 3 boxes, and they'll tell you what the progress is on your renewal. So I've done my application. I get that RN number. That's the confirmation I've completed the application. I've completed my CPD. If you haven't completed your CPD, that will be orange and it will tell you. And the payment, it will, if you've got your direct debit, it will be green by now, but it was just to kind of show you the screen if you haven't finished the bits, because this is what my application form looks like now, because now the payment's gone through. So if you've done everything, this is what your screen will look like. Your renewal application is complete. I've done the CPD and I've got that RN number. You've successfully applied and I've paid. So that's just what it should look like. And I'm going to move on to talk about CPD now. Continuing professional development. And what I want to emphasize is, as far as we're concerned at Social Work England, you tell us how you've learned. We don't tell you it needs to be a certain number of hours. We don't tell you it needs to be particular courses. We do not accredit any training. I know some organizations say this is accredited for CPD. We don't do that. It's not something you need to do. All because we can all learn in different ways. I haven't asked you what kind of social work you're doing. I know you work in very different areas across the country. But what I need to learn as a social worker working in Social Work England is very different from what a social worker working in a fostering agency might need to learn. We do social work in very, very different ways. So we don't tell you what to learn. You tell us how you have learnt. And some of the examples of, obviously, and I think I've got some figures in the slides. The most common form of CPD we get is training courses, which probably makes complete sense to you. But training courses, but there's also options for webinars. There's also options for self-directed learning. So it might be a book, an article you've read. It might be a podcast you've listened to, or a television program. We've had some fantastic examples of people talking about books they've read, even novels. They don't have to be social work textbooks. I was in a session a few weeks ago where somebody was giving an example of a novel that they'd read, where there was a storyline about a family managing early onset dementia, and she explained in a beautiful way about how this had influenced her learning as a social worker. So that's absolutely fine. Things like it might be a television program that you've watched. If there were, it might be a television program about social care, but it also might be a drama. If there's something that might help you learn, you can reflect on and learn as a social worker. You know, for example, it's Black History Month now, and there might be a television program on, I can't think of an example, about the different experiences as being, you know, as diaspora in the United Kingdom, which I know you'll have a great experience of, and it might be that causes you to reflect and think about these experiences and how that influences the people that we work with in social work. As a social worker, and what I didn't talk about my own background as a social worker, so which probably should have done in the introduction, but just to kind of sum up, I qualified 23 years ago. I've worked mostly in adult services and in mental health services. So I've practiced an AMP, practiced as a best interest assessor, and I've worked in forensic mental health as well. And some of the most significant learning I did in my social work was working with particular people and particular families. So do remember that learning on the job is continuing professional development, and it's sometimes some of the richest. It might be going out on a particular assessment and then coming back and thinking, what did I learn from that? Or whatever interaction, working with somebody with a different background and thinking, how does that influence my work? And the other area that we don't see used that much, but I think is really rich, is personal lived experience can be a form of CPD. So it might be one's experience as a parent, or caring for an older family member, or being distant from an older family member, and what that, you know, or going through a period of sickness. These are things that can make us stop and think about. I was at Community Care Live today, and somebody was giving me an example of you know, having to, you know, work with, you know, their uncle was in hospital, and just reflecting on the, to be blunt, the awful care that was provided in hospital, and how that made them think about how they interact with families sometimes, and, you know, hoping not to be like that, but thinking about that experience. And we can all think of experiences perhaps in our lives. So continuing professional development, we don't set, you know, as I say, it doesn't have to be X number of hours, because sometimes the learning that we might do in a 5-minute conversation might be more than a 3-hour training course. It's about the quality of the learning, not the length of the learning. But you will all be doing this. These sessions, you know, will provide you with so much learning, you know, each time, and just some of those conversations we have at work. So really broad, think broadly about what continuing professional development is, because you will be doing this. This slide just really reflects that. It gives some examples. You know, you might be in a leadership role. It might be about managing, reflecting on feedback. I'm zipping through the slides a bit but yeah, the most important thing about the CPD is that you, whatever it is you learn, you're reflecting on it and thinking, how has that piece of learning changed my social work practice for the better? What has it taught me about my social work practice? Or how will I relate to people differently? Or it might be a piece of legal, you know, legislation that you've learned. You know, how will you use that in the future in your practice? That's what we want to see. And this is the standard itself. So there's 8 parts to the standard. I'm not going to go through them all in detail. Don't want to keep you too long. I know you've got, you know, taken your time, but I do just want to emphasize, you do not need to cover all these parts during the year. So this standard is there to support you. You don't have to cover all of it in a year. Last year, I don't think I did 4.2, for example, and that's absolutely fine. You know, if it fits in with the work that you're doing, that's great. It's there to support you, but you do not have to cover it. It says on the side, doesn't it? You should aim to meet all 8 in a year, but it's not mandatory. So don't worry too much about that. The 2 that you have to do are 4.6 and 4.7. 4.7, recording my learning and reflecting on a regular basis, is filling in the form. So if you've completed the form, you've done number 7. 4.6 is reflect on my learning. You again, when we go through the form, you'll see there is a question specifically asking about reflecting on my learning. And that's why it can't just be a description of what you learned. There is a section where you need to reflect and talk about how it will improve your practice. All the others, you can use them, you can not use them. For me personally, I often use 4.8, reflect on my values, because if I'm reflecting on my learning, it often ties in with reflecting on my practice. 4.5 around open and learning culture can often be through if you're discussing in a team or feeding something back. So you'll find ways you can weave these in, but as I say, I just want to emphasize you don't have to. I mean, I'm not going to necessarily ask people to answer, but just to think of, as we're going through, examples. If you haven't done your CPD yet, think of some examples, make notes to yourself as you go, that you can use going forward. Now, on this slide, again, you'll get sent the slides, but examples, there's a little bit on the bottom about examples of CPD. That was added to the social working. It's a hyperlink. It was added a couple of weeks ago, and it does give examples of what a piece of CPD should look like, including the peer reflection. So they are examples from this year. So it's worth having a look at those, because I think they'll really help. One thing I will say about the CPD when you record it is it's not an academic piece of writing. So if you have people that are ASYE doing social work, they will be writing kind of more referenced academic pieces. For your CPD for Social Work England, you do not need to, it's not an academic piece. You don't need to give references. If you read a book that said blah, that's fine to just say I read a book. It doesn't have to have the full referencing. It's a reflective piece of writing, not an academic piece of writing. But do have a look at the examples. So the form itself, I'm just going to go through the form. You access it through your Social Work England account. It times out after 60 minutes, unfortunately. So it's fine if you're doing it and you remember to press save, or you do it under 60 minutes, that's fine. But if you might be doing it and, as has happened to me, the phone rings and then you're checking your email, then you're getting up to make a cup of tea and all of that, then just remember to press save. Or what I do is I usually do it on a Word document and copy and paste it in, just so I don't lose it, because it is really, really disheartening to lose it after that. So just a bit of warning. And this is what the form itself looks like. You'll have done it last year. I just thought sometimes it's easier to talk through the form. So drop down box of the type of CPD. There's lots of different examples. There's also a box for other. So if it doesn't fit into one of those examples and it is another, then obviously they can use that. And then the first part is, in one sentence, describe the CPD activity and why it's relevant to you. And this is around 15 to 30 words. So, and it's just to kind of link it to your social work practice. So, for example, if you, this is an example somebody gave me a few weeks ago. They watched a film on Netflix about some women who were Syrian refugees. I haven't actually watched the program myself, but you can see how there might be lots of learning about working with people coming to the country as refugees and how that might influence some of the attitudes. So you wouldn't just write, I watched a film on Netflix called whatever, but you might write, I watched a film on Netflix called so-and-so, and this helped my social work practice because I'm currently working in an adult team where we're sometimes working with people who are asylum seekers, and this gave me a sense of empathy for them. So it's quite short, just whatever it was you did, how that links to your social work practice. I attended level 3 safeguarding training for adults because I'm currently working in a hospital team, and it's important that I keep my legal knowledge up to date. Yeah, that kind of thing. Very short. The date has to be between the 1st of December 2022 and the 30th of November 2023. If you do a piece of work that takes 3 days, you can only put one date in that form. or 3 months. You can only put one date in that form, but you can explain that in the box below. It just needs to be a date. What we usually say is you put the last date, put the most recent date in the form. And then first question is describe what you've learnt from doing the CPD activity. It's about 250 to 500 words here. You can use the standard, you don't need to. And here's where you'd write, this was a piece of work that took 3 months or whatever. Yeah, the description question, there's not really much to add to that. This is the question that covers 4.6. So this is the next question. Reflect on and describe the positive impact the CPD activity has had or will have on your practice and the people that you work with. So whatever it was, whether it was training course, whether it was working with a particular individual, this is the reflective piece and the thinking, how would that influence my practice in the future? This is really what the reviewers are looking at, this question, more than anyone else. The other thing to note about this question is it would really specifically talk about positive impact. So if you're talking about a really bad training course you went on and you said, oh, it was really awful and, you know, I learned how not to give a training course, that wouldn't meet it. There does have to be something positive in there. I did see an example because I did look at some of the CPD this year, of somebody who literally had, I can't remember what they'd done. It wasn't a training course. It was like a conversation with a colleague or something, and which is great, you know, conversation and supervision, you can learn. But basically their whole part, they said, was everything their colleague said was wrong and everything they said was right. And there wasn't really much learning there. Now, I'm sure that whole same situation, if you're having a conversation with a colleague and they're very wrong and you're very right, you can reflect that in a different way where you would be learning. You're thinking, how can I make my conversation come across in different ways? How do I make sure we get the right outcomes? But this was very much kind of quite blaming and saying, you know, they're, you know, I basically do my social work much better than them, which isn't really the idea. So there has to be some positive aspects to what you've learned. And for one of those, so for one of your pieces of CPD, that's all you do. But for another piece of CPD, you need to do a peer reflection. So at least one of the two needs to be a peer reflection. Who is a peer? A peer can be another social worker registered in England. They can also be a social worker registered in Scotland, Wales, and Northern Ireland. So a social worker registered in the UK, they don't have to be a social worker. So if you're working, I worked in a multidisciplinary team in mental health. I could have had my peer reflection discussion with a nurse, occupational therapist, psychologist, somebody else in that team. If you're managed by a nurse, you know, that is absolutely fine. You can have your peer reflection with them. In the form, you're not naming the person. All the form needs to be anonymous. So when you're writing the form up, you wouldn't say, I spoke to, you know, John Smith, my manager. It would be just, I spoke to my manager who is a social worker. You're not naming anyone in there. The other things about peer reflection is that it can be in a group. So it doesn't need to be one-to-one. It can be informal as well. A few weeks ago, I met a friend of mine who we actually did our training together 23 years ago. She works for Kafkas, and we went to have a cup of coffee, and she talked to me about some of her learning, and she used that as a peer reflection, and that's fine. You know, even though we're friends and I don't work, you know, in her area, I've never worked with children, but I'm still a registered social worker in England. So it can be somebody that doesn't need to be somebody within that work setting as well, as long as you make it clear and you say, I spoke to my, not just I spoke to my friend, I spoke to my friend who is a registered social worker in England. And what are you talking about? What are you writing in this section? This section is at least 250 words. So this is the next step from your own reflection. So I'll give an example because it works easier. So for example, I go on some training to learn about hoarding behavior, and I'm working in an adult team. I've never had the experience of working with someone with hoarding behavior, but going on this course, I'm learning, I'm thinking about the assumptions that I make about people, and I'm reflecting on that. I'm thinking, you know, actually, this is really useful learning. I'm shifting some of my thinking because I don't want to make assumptions about people who might hoard and, the circumstances they've been in. I've heard some case studies. I've thought about it. Then in my next supervision, I talk to my manager about my learning. And it's that conversation that would be written up here. So you've done your learning, you've reflected on your learning, and then you're discussing your learning with a peer. And that, as I say, it can always be in supervision, regardless of what profession your supervisor is, but it doesn't have to be. It can be individual, it can be in a group. So that's what the peer reflection is about. Are there any questions? I'll just pause for a moment. Often that is. Hopefully that's because it's clear. And this is just some information. I've basically talked through that, but there is a hyperlink on the slides to the peer reflection guidance. And this is just some information about last year, about some of the figures from last year. So we had over 220,000 pieces of CPD added, average of 2.3 per social worker. Of course, 2 was the minimum. Training, you can see that training session was by far the most popular CPD that people used, probably unsurprising. And then learning from a case, again, I'd say learning from a case, on the job experience, that is some of the richest learning that I've had as a social worker with a self-directed co. And we're quite surprised in Social Work England to see personal lived experience so far down, but that is what people have answered. So those are the different types, and that was the data from last year. What happens after you submit your CPD? So you submit your CPD by the 30th of November. Don't leave it till the last minute. And then 2.5% of the social workers on the register are selected for review. If you're selected for review, you will be told at the beginning of January. And you don't need to do anything. It's not like the HCPC. You don't need to write up any more or do anything. Social Work England, the reviewers will look at the 2 pieces of CPD that you've submitted, and they'll make a decision about whether it's fine, whether it's passed, or whether you need advice. That's if you need advice. And out of the 2,500 last year that were selected, about 89 were given advice, so it's quite a small amount. You will be told. So the advice is you're told exactly what the issue is. So, and then you will be selected the following year. So you don't need to do your CPD again. Nothing appears on the social work register if you don't manage to do your CPD. You can still completely practice as a social worker. It's just you will be selected the following year. So that's the process of the review. One thing I found, no, I'll get onto it in a minute. Yes, so the assessors last year, they gave these 5 pieces of advice. They asked us to pass this on to the groups that we talk to. This is what they would ask us to pass to the social workers. One is start early. So they've said that they can see the quality gets lower as we get nearer the submission on the 30th of November. So just plan for it. Read the questions carefully. The most important thing about reading the questions carefully, where it says describe, describe, where it says reflect, reflect. Specify the role of the peer. So when you're doing your peer reflection, who is the peer that you're talking to, or the group of peers? Just make that clear. You're not naming them, but you're saying, I had this discussion with my manager who is a social worker, or I had this discussion in a multidisciplinary team meeting where there were 2 nurses and 3 social workers. So we just need to, that one of the things that baffled them. Number 4 is probably the most important of all of them, which is focus on impact. What difference has your piece of learning made to your practice? That's what you need. And number 5, proofread your work. They were now on that, they are not looking for spelling or grammar perfection. You're not going to be marked down if you're making spelling mistakes. The reason the assessors made that as a recommendation is because it makes it clearly easier to read. If you do your CPD on a Word document, you can use obviously spell check. The form that on the Social Work England website does not have spell check in it, but to reassure you, it's not going to be a kind of it. The person doing the reviews wants to know what you're saying, so don't, the odd spelling mistake, grammar, that's not going to make a difference. And things to remember. I'm not going to go through these, but except the last one, which is don't leave it till the last minute. I'm really happy for people to contact me. I've got my email on the slides, but the nearer we get to the 30th of November, the harder it might be for me to help you, because once we get, that last week of November, it's going to be very, very busy. So just, give it a go. Don't worry too much about it. You're doing lots and lots of learning. I just need to pick a couple of pieces. And I've put some links in the slides. There are some events we did at Social Work England for Social Work Week last year. Social Work in England, State of the Nation. That's where I got some of the data figures from about the demographics of social workers. So if you're interested in that, do take a look. This is Social Work. These are some podcasts we've published, again, from Social Work England. The consultations, that's a link to our consultations webpage. Currently, the only consultation open is around best interest assessors, but as consultations come in, that's where they'd go. And then, our newsletter, but also our events. So we provide all free various events for CPD, but also peer reflection, kind of more informal sessions, all of that. So just keep an eye on that website, because that'll keep you up to date with any current events happening. And that's it. So are there any questions? Going to stop sharing.
If anyone wants to ask any questions, can you either raise your hand, or do you want to put it in the chat, and then we can carry on that way.
Well,
Looks like you have been very clear.
Yeah, that's what I was going to say. I was going to
Yeah.
say, I'll assume that's because it's been clear. So, thank you.
Yeah.
And thank you all for your time and for the invite, and I really appreciate it.
I think if there is no questions,
There is Thomas. There is one question on the chat. There's a couple of them. Yeah. When will be the best time to start new registration? Is that, Limna, you want to ask about the new registration to become a social worker with Social
Yes,
Work
sir.
England?
Yes, sir. Yeah.
Okay. Best time is to start as soon as possible.
Oh, all right.
I mean, honestly, because, as I'm sure some of you know better than others, there has been delays in dealing with some of the registrations that come from overseas.
Okay.
What I'd recommend is getting the application in as soon as possible, being really careful to read what is required, because one of the biggest delays is about going back and asking for additional. Now, sometimes that will happen, and it will happen because it just has to happen that there will be additional information that needs to be provided later. But one of the biggest delays is people not providing all the initial information and then having to go backwards and forwards a little bit. So, just to be, really careful when you're doing the application to make sure that all the information is sent. But honestly, I would say start your application sooner rather than later.
Yeah. And then, can I ask one more question, please?
Of course.
Yeah, thank you. I was a student. I just completed my course here in UK.
Yeah.
So, I heard two opinions, like, because I was in a phase of starting my registration now. So I heard that IELTS is mandatory, and from other side, I have heard if I have completed a course from UK, that's not a mandatory thing.
It's not.
So
If you've completed is it your social work course that you've completed
no,
in the
no,
UK?
I have
Okay.
completed here masters in public health, MS in public health.
Okay, if it's a social work course, it's not you don't have to do it. If it's not a social work course, I might need to check that. I'll
Okay.
need to just double check, but because I don't think it is any course in the UK.
Okay. Okay.
But I can double check that and get back to Biju if that's all right.
Yeah, if you can, it will be a great help for me.
Yeah. Let me check that. Double check
Yeah,
that. 'Cause I
thank you
want
so
to-
much, because
No
I
problem.
was really doubted. I have heard both. IELTS is
Yeah,
mandatory and
it's definitely, if it's a social work course, you don't need to, but I don't know about if it's a different course, so I want to just check. I'll check with registration tomorrow.
okay. Thank you so
All right,
much.
no
Thank
problem.
you.
Vicky, on that note, is that just want to check it with you. Will that be possible for us to have a separate section with the membership team for the wider interest of the people who are, I don't know, who are wanting to register in
Yeah,
Social Work England?
yeah,
Because we are getting a lot of queries from back home as well
yeah.
these days.
I think that would be a good idea, and I'll follow up with that and find out if we can set up a session
Okay.
specifically about
Mhm.
the registration process.
Yeah,
Yeah.
that will be very useful.
Registering from
Yeah.
overseas, yeah.
Yeah,
We get a lot
because
of
the
inquiries on it.
yeah, we're getting a lot of inquiries about it, but as well as because there are cultural changes in terms of and the read document,
Yeah.
and how to translate that into the context that they studied, and what kind of like a field work experience they have, the practice-based experience they have, and how to translate that as an evidence into the form.
Yeah.
Many people are really struggling, and we do help some of them, but the challenge is, like we don't know most of these answers either. So
Yeah, no, I'll get onto that tomorrow and see. I'll be in touch about that because I think that'll be really helpful. It'll be helpful for us as well, because sharing that information, making it as clear as possible, obviously helps everybody, doesn't it?
Yeah,
Make
that's
it
true.
useful
Thank you.
for Social Work England as well, not having to go
Exactly.
forth and back, isn't it?
No, absolutely. That it helps everybody. So
Mm. Good. Anyone else has got
Any other
Sorry.
questions? Yeah, so many.
Hello, ma'am. I have a question. I have applied for social work registration, and I got an email saying that I have to do 30 days supervision because I have done social work from India, and it was in 2019, and I have work experience, and then I came to the UK and I did MSc in child and adolescent mental health. So the course is not recognized by Social Work England because it's not particularly for social workers.
yeah.
So I was trying to find social workers to do 30 days supervision, and I found social worker. But the thing is, earlier it was quite easy to do the supervision, but now it's quite the rules and have been changed. So like if I work as a support worker or carer, it won't be helpful because one of my friend worked as a support worker and she applied for
Mm.
she did supervision and she reapplied for the registration, and they said it's Social Work England said it's not acceptable. So could you please tell me like which which job I need to get to do my supervision?
There needs to be an aspect of social work practice in there, so we don't kind of give specific details of jobs because there are so many different jobs that it might encompass, but it's about kind of some of the work that you might do within that job, and linking that to the standards. It might be something that could be easier to have direct conversation with.
Yeah.
Just because I don't think I'm gonna. I mean, I can. Yeah, I'm presuming you've seen the website and you've seen the guidance on the website
I did.
about that. Yeah. So I don't think there'd be anything I can add to that, but I
Yeah.
might be able to clarify if there are particular examples.
Like if I email you, you can.
I'm happy
Like,
for you to email me and I can
so
pick it
much
up.
more.
Yeah.
Oh, thank you so much.
Any more questions? We've got 4 minutes left to hit the 8 o'clock target.
Hi, Victoria.
Yeah.
My name is Somini. I'm one of the senior practitioners working in the multi-agency safeguarding hub for children's services. Mine is not a question. It's just to give you a bit of a feedback. I can't thank you enough for making this such absolutely clear as to what is the expectations when we record our CPDs. As you know that we are the frontline services, so the direct intervention with the families is limited. We mainly make the initial decision as to what is the follow-up actions for the children. So in that terms, your direct work is limited. Therefore, there is a theme coming up as to what exactly you record on your CPD. And you made it extremely clear as to it could be a piece of your reading, it could be a podcast that we watch, it could be even a novel, and you read and how you reflect what you learned from that and how you imply that in your practice. So that's extremely useful piece of information, and we'll be having our next team meeting tomorrow, and I'm sure this will be a reassurance for our team when they hear that, this is what the expectation, and anything can be, anything, a piece of reflection, a learning can be recorded as your CPD. So a massive thank you for that.
Oh, thank you so much. I really appreciate that.
My pleasure. And just some clarification, Victoria.
Yeah.
You mentioned about if we are randomly selected and if we are in that 2.5%, you said that we can still continue as normal. But you did say something afterwards saying that they will be advised. And did you say that we will be selected again next year? Is that what you...
Only if you don't meet the requirements, like if the piece of your CPD has not met the requirements, you will be selected the following year.
Aha.
But there will be no implication on your practice. There is nothing publicly on the register. Nobody knows that you have, nobody would know that. In fact, we don't tell your employer. So it would be up to you if you want to tell your employer again. There's no implication on your practice. It's just you would be selected the following year. If you don't meet the requirement. If you meet the requirement, you might be selected the following year because you might be selected completely randomly the following year. We have had situations. We had situation last year. I feel really sorry for the person, but literally they had been selected 4 years in a row from between the HC, and they said they made a complaint and they said this can't be random. I've literally been selected 4 years by the HCPC, and like literally we had to go back and say no, it is completely random. Really sorry for you, but so even if you have done everything right on your CPD, you might be selected randomly again. But if you haven't done your CPD right, you will be selected. That's not random. Does that make sense?
Absolutely.
Yeah.
Yes. Thank you for making
All right,
that
no
clear.
problem.
Thank you,
So,
Victoria.
just on a lighter side, maybe we need to ask that person to take a lottery soon.
I know. I tell you, like when we heard about it, all of us had so much sympathy for them because you can't help but think that wouldn't be right. The chances of that must be very, very low.
Yeah.
But yeah.
Thank you, Victoria.
No problem.
Any more questions?
Right.
Yeah,
Just
I
before,
just want to. Sorry,
Someone Finsey.
I finish it. Yeah.
Sorry,
Can I-
just before we
Finish.
sorry,
Yeah,
finish.
actually, I just wanted to share my concern that in the month of February, I had applied for the social work registration, and it took a lot of time. Still, the registration is going on, and
Yeah.
as one of the social worker also mentioned about, I'm working as a support worker, as a residential support worker. So when I heard about it, now I'm thinking whether the 200 days placement will be the required mandatory will be fulfilled or something like that. Uh, so I wanted to just ask that the process is very delayed actually.
I know.
Yeah. So
Yeah.
can you say anything? What's the reason or what?
It's because of the big increase in the yeah, I've talked about the 180% increase. We have got people who have been moved specifically just to work on international, registrations, but it has been, as you know, it is delayed. I don't really have a better answer than that, except it is something we are very aware of in Social Work England, trying to really to improve on. And I know that doesn't make it any easier for you.
Yeah.
Yeah.
Okay. I think
Yeah, just
we close it today. Yeah, we had 49 participants on
Yeah.
stage. That was a very
Yeah,
good
50.
number. So
Yeah.
so yeah, so we're going to just inviting Sheena to give the vote of thanks.
Yeah, just before Sheena says conclude it, just want to say word. We had around I think 50 people around the It's a very good number, very good turnout. We will be continuing with our sessions again, further sessions. And as Biju mentioned, with the support of Biju and the resource team, we are trying to do a big event very soon. So I'm expecting a lot of participation. Let's make it as a really big event. So do please, look out for the invite and the details when it is coming through. So back to Sheena. Thank you very much. Sheena, are you there?
I am here. Sorry. Thank you so much, Victoria, for the very informative session. So sorry about the background noise. It's a privilege for the UK's MSW Social Work Forum to have you here and share with all the information which we need to share. And the CPD session, what needs to be included, what needs to be conducted as a reflective practice, peer reflection, all sort of things, what needs to be done and when needs to be done. Everything was very clear, very informative, and thank you so much for your kind time for 1 hour session with us. Thank you.
Okay.
Just
You're
on
on
mute
mute.
to say thank you. Yeah.
Yeah. Thank you very much, Victoria.
Thank you.
And all those who participated today. Yeah. I know it's you had a busy day today, and then it's your rest time but you choose to join us today. So thank you very much.
Thank you. Thank you.
Thank you.
Have a good evening.
Yeah,
Bye-bye.
you too. Thank you.
you.
Bye-bye. Bye.
Bye.
Bye, everyone.